The central nervous system is the body's control center. It receives, processes, and transmits information. This complex network consists of the brain and spinal cord. The brain, encased within the protective skull, governs our thoughts, emotions, and actions. The spinal cord, a long, delicate structure extending from the brainstem, relays signals between the brain and the rest of the body. Together, they orchestrate every aspect of our being. Understanding the central nervous system is crucial for medical professionals. It allows us to diagnose and treat a vast array of neurological conditions. These can range from headaches and strokes to movement disorders and neurodegenerative diseases. This essay will delve into a specific region of the brainstem, the rhomboid fossa, and its significance in neuroanatomy. The rhomboid fossa is a diamond-shaped depression located on the dorsal surface of the brainstem. It is a critical area for understanding the organization and function of cranial nerves. These nerves are responsible for sensory and motor functions of the head and neck. The rhomboid fossa is formed by the widening of the central canal of the spinal cord as it transitions into the fourth ventricle of the brain. Its unique shape and location make it a prominent landmark in neuroanatomy. Studying the rhomboid fossa provides insights into the intricate connections between the brain and cranial nerves. The rhomboid fossa is not a smooth, featureless depression. It possesses several important landmarks that help us navigate its surface and understand the location of crucial structures. The median sulcus is a vertical groove that divides the rhomboid fossa into two symmetrical halves. The facial colliculus, a small bulge, marks the location of the facial nerve nucleus. The striae medullaris, delicate white fibers, represent the pathway of the cochlear nerve. These landmarks serve as reference points for identifying the positions of cranial nerve nuclei. Understanding their locations within the rhomboid fossa is crucial for interpreting neurological symptoms and diagnosing brainstem lesions. Cranial nerve nuclei are clusters of neurons located within the brainstem. They serve as the origin or termination points for the axons of cranial nerves. These nuclei are organized in a specific pattern within the brainstem, reflecting their functional roles. Some nuclei are sensory, receiving information from the head and neck. Others are motor, sending commands to muscles and glands. Still, others have both sensory and motor components, reflecting their complex functions. The arrangement of these nuclei within the brainstem follows a predictable pattern, making it easier to understand their respective functions. Section 5. Mapping the connections cranial nerve projections on the rhomboid fossa. The axons of cranial nerves emerge from or enter the brainstem at specific locations, often near their corresponding nuclei. Some cranial nerve fibers project onto the surface of the rhomboid fossa, creating visible landmarks. For instance, the fibers of the facial nerve loop around the abducens nucleus, forming the facial colliculus. This distinctive bulge is a key landmark for identifying the facial nerve nucleus. Understanding the projections of cranial nerves onto the rhomboid fossa helps us correlate surface anatomy with the underlying organization of cranial nerve nuclei. This knowledge is invaluable in neurology for interpreting clinical findings and localizing lesions. Section 6. Cranial nerve, exit points, pathways from brain to body. After leaving the brainstem, cranial nerves exit the cranial cavity through various foramina, which are openings in the skull. Each cranial nerve has a designated exit point, allowing it to reach its target organs and structures. For example, the optic nerve, or cranial nerve 2, exits the cranium through the optic canal to reach the eye. Knowing the exit points of cranial nerves is essential for understanding the pathway of these nerves and their potential points of compression or injury. This knowledge is crucial in diagnosing and treating conditions affecting cranial nerve function. Section 7. Clinical significance. When the rhomboid fossa malfunctions, damage or lesions within the rhomboid fossa can lead to various neurological deficits. Depending on the specific location and extent of the damage, patients may experience problems with their vision, hearing, balance, facial movements, swallowing or speech. For instance, a stroke affecting the medulla oblongata, where the rhomboid fossa is located, can result in a life-threatening condition called medullary syndrome. Understanding the anatomy of the rhomboid fossa and its relationship to cranial nerve nuclei is essential for neurologists and neurosurgeons. It allows them to accurately diagnose and treat conditions affecting this critical region of the brain. Section 8. Conclusion: Mastering the rhomboid fossa for medical excellence. The rhomboid fossa, though small, is a crucial region of the brainstem. It serves as the origin and termination point for several cranial nerves and provides valuable insights into the organization and function of the nervous system. By mastering the anatomy of the rhomboid fossa, medical students can gain a deeper understanding of neuroanatomy and its clinical significance. This knowledge is essential for the accurate diagnosis and treatment of a wide range of neurological conditions. Studying the rhomboid fossa is not just about memorizing anatomical structures, it's about comprehending the intricate workings of the human brain and using that knowledge to improve patient care. This video, made by Karthikeyan, medical student,